What happens when frontline healthcare workers feel unsupported or unheard? In this episode of The Exam Room, we continue our conversation with community health worker Joslyn Mikeworth, diving into the realities of workplace culture, advocacy, and speaking up on behalf of both patients and staff. From navigating difficult leadership dynamics to finding the courage to use her voice, Joslyn shares what it means to advocate in challenging environments and why being heard can make all the difference.
Being a CHW is vastly different than being an MA or a CNA. Can you speak a little bit more to that?
When I was working as a CNA or an MA, I felt like I wasn't doing enough. Like I could help the patients while they were with me, but I wasn't able to actually help them when they were at home. I felt like there was just a gap in care. And I feel like working as a CHW, my position is that gap. Like it's to take care of that gap and bridge it. I just feel like I do a lot more outreach, so it's more talking to patients and what do patients need instead of taking care of their immediate needs, like, oh, you need to be administered this medication, so let me go administer it. Or you need your brief changed, like, let me change your brief. It's what do you need at home to survive? Like, what can I help you with at home? Or what will make you more comfortable coming into the clinic and getting this done? I just feel like it's two kind of different things.
Yeah, that makes total sense. And Canyonlands is doing something really cool with their CHWs, right? You're starting to have like regular meetings and trainings and stuff. Has that started yet or?
So since I started, I've been doing regular meetings and trainings. We have a meeting every Monday and we just kind of go over what we're going to be working on for the week. If anybody has questions or needs help with something, that's kind of our time to discuss it. And then we also have a monthly meeting with the population health team to go over kind of everything we're going to do for that month. And they usually do a little training in there.
Hmm.
And that has been amazing.
It sounds like the leadership at Canyonlands is very supportive.
They are, my manager is so amazing. I just love her. She is always so smiley and so polite. And like I said, she's just there, like whenever you need her. And even if she's not there, she still answers and she takes care of business. She gets it done.
Mm-hmm. Yeah, and the opportunities that I've had to work with her and partner with her, she is the same way with me too. And I think that culture, that support culture, that is huge.
It 100% is. It makes all the difference. I feel like your manager can make or break the job. Like it does not matter how much you enjoy the job. If you have a bad manager or not even a bad manager, but someone that doesn't suit the role, it can ruin it for you. Like you can have amazing coworkers and absolutely love the position, but when you have a manager that reacts like the one I spoke about earlier, it makes it almost impossible to stay.
Yes, it makes me think about I was looking to transfer from one campus to another campus way back when I was program managing. And I was speaking with the dean of the campus I was wanting to transfer to on the phone, kind of a initial phone interview, if you will. And at that point, she asked me a question that I had never been asked by any manager, supervisor, whatever you want to say, in my whole life up until that point. And she said, okay, well, I just have one last question for you. And that is, how do you like to be managed? And I'm not usually at a loss for words, but I was at a loss for words. Nobody had ever asked me that before. I had to think about that. And that's the kind of person that she was. And I was so appreciative, and probably one of my first mentors, that she recognized that not all of us need the same things or flourish under a certain type of management. And I think that's important for leadership to remember too, that all of the persons that work with us, they grow under different management styles.
Yeah, I 100% agree.
Well, as we kind of move away from this topic, I want to shift gears a little bit and talk more about engagement and support as far as for our patients. We created a diabetes patient education program, and 3 of the Canyonland clinics are rolling that out to patients. But it's not just about educating patients, right? We want to help them manage their care better. That's the whole point, to see some sort of behavior change. And education alone doesn't do that. Like the connection, the relationship, the support, all of those things, the trust building, the bridging that gap, like you said, I think relationship is a huge part of that bridge. And for me personally, as a patient, somebody just knowing me, that I'm not just another box that you're checking because you have to make a phone call, but you actually remember who I am and that I have 2 little dogs and they're my fur kids, or whatever that connection looks like on that personal level. And many patients, like I said, have told us they wouldn't have finished this diabetes program. It's like 7 modules. They wouldn't have finished it without your help. What do you think makes connection so important in your role?
I feel like connection is just the whole base of the role. Like, we can't bridge that gap without knowing who our patients are. At least I wouldn't allow someone to know about my home life if I didn't know that they knew me.
Yeah.
And it's a big part because, like I said, you're bridging that gap. You're trying to connect what's going on in the clinic with what's going on at home and making sure that they have the resources to put what needs to be put in place in place. You can't do that with a foundation of trust. So just getting to know your patients really makes that difference, because you see them as like an actual human being instead of, oh, room 6 needs this.
Mm-hmm. Mm-hmm.
Absolutely. That is such a great point. When I'm teaching my students, I will remind them that it's not just the patient in room 2 that's having their appendix out. Like, it's not just an appendectomy. Like, this is a real person. They have jobs, they have families, they have worries, they have hopes and dreams and all of those things. And not to forget that they're not just their disease or their condition or their procedure, that they're actually that unique human being.
Yeah, I feel like that's so important. And as a patient, listening to your patients is what builds that foundation. When I'm trying to tell a doctor what's going on with me and they're like, oh, you just need to lose weight. And I'm like, I'm constantly vomiting because I need to lose weight. That doesn't make sense. Oh, yeah, you just need to lose weight. I feel like that's a big problem because they're not seeing me. They're just seeing, oh, this person's overweight and this is why. And they just need to fix that and everything else will be better.
Mm-hmm.
Instead of actually listening to what I'm concerned about.
I think that's so important for me as a patient too, especially after they have all of my information from my chart there and they're seeing me and they're asking me, did I get this certain test, which I can't even get because I don't even have that body part anymore. Like, did you not look at my chart? Like, did you not? Yeah. And I understand the time constraints there, and that's why I think this team approach to patient care, like the provider can only do so much in this 10, 15, 20 minute window that they have the patient kind of in front of them. And I think that just makes the team approach really work so that the patient can get the best care. You talked a little bit about how you get to know the patient and trust building and those kinds of things. What about when you have a patient that is feeling really overwhelmed or discouraged or unsure about managing their health? What are some things that you do to help those patients?
I listen to them, and I you want to find out why they feel that way. Like, if like no matter the reason, the the why is what's most important. Like, however it comes about, you want to know why, because you can go from there and you can take that and you can build on it, and you can, like, there's so many different ways to get your patient confident. And my biggest one is just encouraging them. When I was working at the hospital, we would have patients all the time be like, I can't do that. And you have to be like, no, you need to try to do it, because if you can't do it, the only way you're going to get better is by trying and working on it. And again, keep on trying and keep on pushing to do better. And if you don't do that, you're just going to get worse. And I felt like a lot of times, just sometimes you had to be blunt and be like, no, I'm not doing that for you because you can do it yourself. And then they do it themselves and they're like, oh, I can actually do that. Like, I don't need someone to do that for me. Just promoting their independence and being like, you can do this. Like, you got this, you can handle it. And just that encouragement makes all the difference.
I think, too, the realization that we are all motivated by something, right? To find out what that is, right?
Yes.
Because if you can find out what would motivate that person, then, like, that's the secret sauce.
Yep, it makes all of the difference when you can, like, kind of do that motivational interviewing and kind of get to that, what motivates you? Why do you want, what makes you want to be better and do better and be able to do the things? It makes all the difference.
Can you think of a specific example of, with a patient?
I had a patient come in to do the diabetic education. I didn't really need to do any motivational interviewing, but he was like, I want to get healthier because I want to see my grandkids grow old. And that, it just pulled at my heartstrings. I was like, oh my gosh, like, that is the sweetest thing ever. And like, let's do this. Like, let's figure out what we need to do to get you better and in a better place. I mean, we did our best. So he's doing better, and he loves his grandkids. They're so cute.
Oh, that's such a great story. And it I don't know if this is the same patient that you're speaking about, but there was the one individual in our patient education, much older gentleman, not computer savvy at all. And when I interviewed him and I said, well, what would you change about the program? And he said, less computer work. But he came in every week and you helped him through it.
It's not the same patient, but that patient is probably right now one of my favorite patients. He did not give up. He would come in and he would get frustrated, and sometimes he would do more than one course, but a lot of times he would just come in and do the one course because he would just get overwhelmed. And he, at the end of it, he was like, this made a big difference. Like, it helped me understand, and I learned a lot. And I was like, that's the goal. Like, that's what we want for you. Like, we want you to understand your diagnosis and know how to better manage it. But not only that, we want you to feel comfortable to ask us questions. And the difference, like, when we first started, he would just sit there and grumble and try and figure it out. And I'd be like, do you need help? Like, are you confused, or are you stuck? And he's like, I just don't understand what I need to do here. Like, it's because we have those sections where they have the boxes and you have to connect the box. It just wasn't connecting for him. So I was like, oh, like, you just have to drag the box over here. And he's like, oh my gosh, that makes so much sense. Like, I don't understand computers. And just kind of building that trust, like, yeah, I can help you. I'm not gonna, like, get after you for not understanding it. Even I have trouble with computers sometimes. Like, they're not easy machines to work with. So just kind of building that trust.
I love how you talk about how supportive the leadership is, and then you take that and you give that same thing to your patients. And that just makes me feel so happy.
That was my biggest issue with working as an MA and as a CNA was I felt like I couldn't do that for patients. Like I did my best. Like I I always tried to be there for patients like when they had a hard day or if they were just like down on themselves like okay, you're having a bad day, let's get you dressed. Like let's get a shower, let's brush your hair. Like let's get you taken care of so you feel a little bit better because I feel like when you do those little things, it makes all the difference in how you're feeling. Like of course you're going to feel like crap. Nobody's giving you a bath in however many days. Like
Mhm.
you feel dirty and it just makes you feel worse.
Mhm.
And so even like the ones that did get a bath, a lot of times when you're in the hospital, at least for women, when you're not really mobile and can't do it yourself, a lot of times hygiene goes unnoticed. Like I've had patients whose hair I've had to sit and like demat for an hour because nobody thinks, oh, this patient needs her hairbrush. But that's the reality of it. Like you have to train yourself to notice these things
Mhm.
to make those patients more comfortable because when they're in bed and their hair is matted and it's hurting them and they can't even run their fingers through it to kind of untangle it, like you're of course you're gonna feel worse. And it just makes all the difference to do like the little things like help them brush their teeth, help them get their hair done, help them take a bath, like whatever it is, get them in clean sheets and a gown. And
Yeah.
it makes all of the difference.
I was thinking about one of the patients that completed the diabetes education, and I did the exit interview with him. And so I was talking to him about some of the elements in the training and did he like them and so on and so forth. And he said that he found them engaging. So then he specifically was talking about taking his blood sugar at home and how he was getting kind of all of these wacky results. And I said, oh, well, there's a video in the course about how to take your blood sugar. Did that help you? And he said, honestly, I skipped over that video because I didn't think I needed it. And I'm like, oh, well, why? And he said, because Joslyn showed me how to do that in the office. And after that, I was able to do it at home and I didn't feel like I needed that video. And that really struck me. It stuck with me because it can't just be the patient on the computer getting some training. Like, we need to have this additional support for them. And you are definitely that.
I try.
It shows. It definitely shows.
Speaking up is only part of the story. The real impact comes from what happens next. In the final episode of this series, we'll continue our conversation with Joslyn Mikeworth and explore what meaningful change can look like, from stronger leadership and accountability to building systems that truly support frontline staff and the communities they serve. Thanks for listening to The Exam Room.